Hello everyone, myself Dr. Tapush and welcome to our channel Physiomax Organization. As we are continuing our medical education series and we are continuing the different pathological conditions of related to the shoulder joint, and already in different series of orthopedic condition of the shoulder joint we have already seen that subacromial bursa, what are the different causes of subacromial bursa and who are more prone to have a subacromial bursa. Also, we have seen exactly where is the subacromial bursa is and why, because of the repeated stress, the subacromial bursa will have a inflammation. Today, in this video, we will understand that how easily we can diagnose a condition of a subacromial bursa, rather if it's not a condition of a supraspinatus tendinitis, because both the condition mimics the same pathology, both the condition mimics same type of pain in a same location. So today come let us see that how easily with few of the physical diagnosis and without doing any sort of special test, with just few of examination we can understand the subacromial bursa is. So first let us see the subacromial bursa region, as if I just have a schematic diagram of the acromion process. This is how the head of the humerus. So I have drawn the head of the humerus, and this is exactly the place where the subacromial bursa sits like a fluid-filled sac of a synovial fluid. This is where is the subacromial bursa. So just mark this as a subacromial bursa. So this is the acromion process. This is the acromion process and this is the head of humerus. This is the head of humerus, and this is the space which is called as a subacromion space, and in this space the particular structure which is present like a fluid-filled sac which looks like a capsule, and that is what's called as a subacromial bursa. So whenever someone used to do a repeated movement at 90 degrees of abduction, they are more prone to have this subacromial bursa. That's already we have seen in the last video. So today we'll understand that with few easily example, with few easy assessment, how we can understand that it is a subacromial bursa and why it is not the supraspinatus tendinitis. So to understand that, we'll just make the patient to go with a stand in this position, anatomical position, and consider this is the anatomical position of the patient, and we will ask the patient to do a arc, that's an arc of 180 degree. So if it's a 0 degrees of abduction, if I consider this as a 90 degrees of abduction, and if I consider this as a 180 degrees of abduction, well, most of the times you ask the patient to do the abduction of the arm. So consider this patient will start doing the abduction of the arm from 0 degree to 90 degree and from 90 degree to 180 degree. This is what's called as a painful arc, and when the patient used to have a pain exactly at 90 degrees of abduction and throughout the arc the patient does not have any sort of pain, so like here the patient does not have any pain, 0 to 90 degree the patient does not having pain, and only in this 90 degrees of position the patient is having pain, that's the classical symptoms of subacromial bursitis. And again, when the patient will do the full arm abduction and when they return back from the abduction towards the adduction, exactly again in the 90 degrees of position the patient used to have a pain. So by that we easily understand that it can be a subacromial bursitis. Now we need to understand that the difference between the subacromial bursitis and supraspinatus tendinitis. Now why we need to understand these two conditions separately, because the patient those who are having a subacromial bursitis and the patient those who are having a supraspinatus tendinitis both will have a pain exactly at this glenohumeral joint below the subacromial space. So it mimics the same pain situation. So it's very difficult for the physiotherapist to understand the difference between the subacromial bursitis and the supraspinatus tendinitis. Now with few of the physical examination, how easily we can understand that it can be a subacromial bursitis. So one point I have already told you people that if the patient is having a pain at 90 degree, it can be a subacromial bursitis. The second thing, those who are having a supraspinatus tendinitis, they will have a difficulty at 0 to 10 degrees of abduction position, because we know initiation of glenohumeral abduction, it is mostly done by the supraspinatus muscle, and again from 90 degree to 110 degrees of R, the patient used to have a pain. So for the subacromial bursa, the patient used to have a pain only at the level of 90 degree, but for the supraspinatus tendinitis, they will have a pain in the initiation of the range of motion, that is from the 0 to 10 degree, and again from 90 degree to 110 degree. So in these two R, we can understand that with a simple, with this painful R, you can easily understand that which is the subacromial bursa and which one is the supraspinatus tendinitis. Now come see that what is the second way of examining the patient, that it can be a subacromial bursitis or it can be a supraspinatus tendinitis. That is what's called as a resisted isometric testing. So those who don't know what is exactly this, just have a message in the comment box of this video. For them, I'll make a separate video. This what is this resisted isometric testing. As of I will tell that resisted isometric testing, it is a test procedure to understand the pathological condition related to any type of soft tissue structure, mostly any type of muscular structure or not. For supraspinatus tendinitis, the resisted isometric test, it will be positive, but for the subacromial bursitis, it will be negative. Why? Because whenever in a 90 degrees of abduction at a particular position, we used to do the isometric resistance against any movement, those who are having involvement of a muscle, they will have a pain. It can be a strong and painful, it can be a strong and painless, it can be weak and painful, or it can be a weak and painless. But for the subacromial bursitis, this resisted isometric testing, it will be negative. So with this, we will understand again that it can be a resisted isometric testing, it cannot be a subacromial bursitis. So if the test is positive, then we can click in our mind that it can be a supraspinatus tendinitis instead of the subacromial bursitis. So with these few easy understanding of a examination procedures, we can also understand that it can be a which one, like a subacromial bursa or the supraspinatus tendon. Also with a basic AROM and PROM, this also give a clue that it can be a subacromial bursa or supraspinatus tendon. Mostly if it is a supraspinatus tendon, if we do a PROM, it is painless, but if it is a subacromial bursa, if we do a AROM, it is painful. These three easy classical example, classical examination we do before we go to do a special test or before we ask the patient to go for any type of MRI of a particular structure. Of course, MRI give a clear picture of a level of the supraspinatus tendinitis or a subacromial bursitis, but before doing any special test, before doing any sort of MRI or any costly investigation, we should do this test. So I think viewers, you people have understood that with few physical examination, which all the physical examination is very important to do to diagnose a subacromial bursitis and a supraspinatus tendinitis. In the next video, I will tell you which special test it is mostly indicated to diagnose a subacromial bursitis. Till that time, just watch this video. Any doubt, just comment in the video box, comment box, and those who are new for this channel, don't forget to subscribe the channel, and those who are seeing our all the series of the videos related to the orthopedic and the different type of pathological condition, don't forget to like this video. Thank you.